Well, it's the end of a very long but very interesting day, certainly from my perspective, and I hope that for you that you found it equally interesting. I think that we've had a really wide variety of presenters from very different perspectives, and again I just reiterate that having presentations and discussions and questions from people from across the spectrum of interest in this area I think is really critical, and I'm glad that it's not just New South Wales Health sitting here and talking to ourselves about what we think is important. So from that perspective I think it's been very, very helpful. So just a quick summary, because I know that if you're feeling like me, it feels like a very long day. I'm just trying to make this work.
Push towards the back of the room. Shoot towards the back of the room. That's where the battery might be starting. Just maybe call it else.
Next slide, please. Here we go. So we've heard today about labelling, and so changing the environment through labelling and tools like 8700, the Health Star rating, as well as apps like the Food Switch. We've also had presentations around reformulation, so the Food and Health Dialogue, food and nutrition research strategy, the heart tick. I think that was a fascinating discussion. Healthier oils, some of the industry-wide and individual food manufacturer initiatives. I think we don't hear about these as often, so certainly from my perspective, very interesting to hear the work that's happening there. We've also heard about local councils and the potential, and had a terrific case study from the Illawarra, which I think again sort of shows us that that we're talking also about communities and the involvement of communities in shaping this area, and then the supermarket environment around the range of options and some of the things that our retailers are doing. Now, I'm sure this list isn't exhaustive, but we've tried to keep a pretty good tab on the range of things that have been raised, but as has been said several times today, we do have an email address that you can send other ideas to. We have talked about reformulation, and there's been the question about, do we talk about this loudly or are we silent about some of the things that have changed in the food supply? But very clearly a strong sense that we need to support the food and health dialogue. The issue of increasing consumer awareness of kilojoules, I think, has permeated most of the sessions that we've had today. And again, putting salt and saturated fat on the agenda, I think, is something that's been raised in the 3 sessions today. Portion and serving size and how we address this is a consistent theme, and the potential to use the Council IPR framework, the Integrated Planning and Reporting Framework, which has been the work through PCAL has looked at that from a physical activity perspective, but perhaps also the opportunity to look at that from a food and nutrition perspective. We've heard about the retail environment and the opportunity around product placement and price, but I think clearly that what we do need to keep in mind that there's to see change in this area, we need to be working across a range of strategies, across a range of areas as well. And underpinning all of this, I've been quite, I think, a little surprised about the consistency of the issue around education to increase health literacy and to complement this work. I'm not surprised that that's an issue that's raised, but in a food forum where we're particularly looking at the environment, clearly this is an area that people think is important to happen at the same time. So at the beginning of the day, we looked at this wheel in relation to the different places that we might be able to intervene, and some of these things we've talked about today, like labelling and the composition and promotion and retail, for example, but there are other areas that we haven't touched upon, and so I mean just at the very end there were issues raised around promotion and advertising to children. So the next steps for us, and building on this as well, is that we will be taking the ideas that have come through to the forum, and then we will be establishing some work workshops which will be targeted probably around about 4, but we'll wait and see, because I think that the more that we start to think about this area, the more we sort of see the complexity and also the many, many opportunities. One of the things that we've been doing concurrently to this process has been we've been working with the University of Sydney and the University of Queensland in relation to the evidence that supports intervention across the whole food policy and food environment range of options. And so we'll be wanting to bring that evidence to bear in our stakeholder workshops and start to think about, well, if we work in this area, what would be some of the potential impacts, what are some of the potential unintended impacts in terms of that sort of equity differential which we don't want to perpetuate. But again, as I mentioned this morning, we do need to be thinking about what's feasible and acceptable and thinking through what some of those risks are. So our workshop process will be over the next couple of, well, probably over the next 6 months. We haven't yet crystallised the process for those workshops, but we'd certainly will be expecting that we will have a range of stakeholder perspectives involved in those workshops. Now, today's presentations will be available online for you to look at, and we'll write up a report which will be available on our website, and please send your other ideas to the Food Forum New South Wales email address. I'll just mention briefly too that we've been monitoring the Twitter conversation, and I don't know if this is a big number or a small number, but because this is the first time we've done this in the Centre for Population Health, but I think we've had over 600 tweets, so clearly a lot of discussion happening at the same time as the presentations, and I must admit I'm going to be quite fascinated to look back and see what sorts of reactions were coming from the crowd, a bit like Q&A really, isn't it? To see how people reacted to the different presentations and perspectives and the questions that were raised as well. So I think that will give us a little bit of an insight into the varied perspectives from people in the room. So now, the thank yous and the formal thank yous. I mean, and I think that this audience would know that putting together a forum like this takes a lot of effort. The first thing I'd like to do is to thank our partners. So the Ministry of Health has been working with the National Heart Foundation and the Premier's Council on Active Living in bringing this together, and it really has been a true partnership project. I'd particularly like to thank Megan Cobcroft and John Weinberg from the Ministry of Health, also Barbara Eden from the National Heart Foundation and Rebecca Costello from PCAL. We couldn't have done it without the support of the team, so thank you. I'd also like to again, thank our speakers. We've had many speakers from interstate who have dedicated quite a lot of time in busy schedules to be here. So I'd like to thank all of our speakers who I think have helped to contribute to make a really positive day. I'd also like to thank Adam Spencer for ably bringing us through what's been a very busy day, but also has ably brought us through bringing together the different perspectives and keeping the conversation going. And finally, I'd like to thank you as the audience. There's been an overwhelming feedback from people in the room about, gee, it's great that you're having this. Clearly people are voting with their feet, that they've actually arrived, and most people are still here as well, which is just remarkable. And again, just reiterating, having the interest from such a broad range of stakeholders is terrific. So it's the start of a journey, which I don't think is going to necessarily be particularly easy or simple, but I think it's a really important part of what the New South Wales Government is doing in relation to improving healthy eating and active living in the state. And I think I can't help but reflect that as someone who's worked in the health promotion field for many, many years, what's most important to me about this forum is that we're looking at changing environments, or looking at what's the best way that we can help to change the environment to help people make healthier choices and to make those choices easier. So I'm really very, very excited about the next series of iterations of what we do, and very hopeful that at the end of this process we'll have some very solid options for moving forward. So thank you to everybody for helping us with this.